Welcome back. I'm Barry Craig. Post-traumatic stress syndrome is most commonly associated with military, but it also can affect civilians. And with me to discuss PTSD is Leslie Page, a psychology instructor at the campus, and she's also a professional psychologist. Welcome to the program.
Thank you.
Again, you turn on the television, you read magazines, newspaper articles, PTSD is you think it's a military thing, but it's not.
Right.
Explain what it is and how it affects people.
Well, PTSD can occur from a variety of different kinds of situations. Typically, someone is either exposed to a trauma, maybe they're attacked. It happens a lot with women or men who are raped or assaulted or robbed. It can also happen if you witness someone else who is about to be killed or is killed. It can happen from witnessing a car accident. It happens a lot from natural disasters, so being in a tornado or earthquake. It seems to be more likely to happen from man-made events rather than natural disasters, though.
Why is that, do you suppose?
Well, it's just harder for us to wrap our minds around when maybe like a terrorist attack or something, or the Newtown shootings. It's so much harder for us to understand that people could do things like that. So it's easier to understand an act of nature, an act of God. This is, a tornado. That's easier to deal with than it is to accept that people, that there are evil people out there.
Now, in terms of military, PTSD is what in World War I was called shell shock.
Right, right, and now we've put a name on it, which is good because we've really brought a lot of awareness to the issue. So a lot more people are being diagnosed now than ever before. That's not just because there's greater awareness, it's because there's greater prevalence now too.
You work with military victims of this in Hopkinsville. These are soldiers from Fort Campbell.
Yes.
Do they come see you voluntarily, or are they required to do this?
Now, I've seen some outpatient, and I've seen a lot of families of soldiers outpatient, but most of what I see are involuntary hospitalized inpatient.
Well, who makes it involuntary? The military requires them to do this?
Sometimes the military will bring them in. Sometimes their friends or other soldiers will bring them in. Sometimes the family wants them to come in.
Well, you mentioned the involuntary aspect. Is it because a lot of soldiers don't want to admit that they have this?
Well, just, people in general usually that need help don't want to admit that they need help. So
denial, then.
Yeah. There's a lot of denial with PTSD.
Well, now, what would cause the denial? I mean, if you have this, you surely know you're messed up. But what, do you think that you could work it out yourself? You don't need help. Or you don't want to tell people?
You just don't want to talk about it. And so that's why we see so many avoidant behaviors. Drinking and drug use being big ones. And I always tell people when they come in, I'll ask them, do you ever drink or do you use drugs? And if they say no, I say, don't start. Because it works for the symptoms. Alcohol works to deal with those symptoms. So that's why we frequently see comorbid substance abuse disorders with PTSD. But the avoidance is a huge part of it. So they avoid, with any kind of PTSD, you will avoid anything to do with that original trauma. So depending on your terrain where you were deployed, maybe now you avoid certain areas of town, or you avoid places where you would hear certain sounds or certain smells. There's a lot of driving issues with PTSD from these soldiers. If they are driving down the road and they hit a bump in the road, it scares them because that might be an IED. So they're very what's called hypervigilant. So they're constantly scanning, looking for danger, even when they're back over here. And one thing I've noticed about some of our students who were soldiers, they always sit in the same part of the classroom. They will sit in the back corner so they can see the whole room and assess for danger. But yeah, avoidance is a key symptom of PTSD. The last thing they want to do is talk about it, and that's what they have to do to get better.
You mentioned the hypervigilance of, I've heard stories of World War II vets experiencing the same thing. There was a man in Mayfield who was a Japanese prisoner for several months, and just the slightest noise would set him off. He was constantly on edge. And you know, even if you haven't had a traumatic situation, sights and smells and sounds remind us of all kinds of things, sometimes pleasant. Right. So that's a natural human emotion then to do that. Now again, well, how do you treat this? And of course, you know, the old expression, confession is good for the soul, and talking things out almost always work. Yeah. So how do you treat this typically?
Well, I mean, one of the first things you want to do is you want to make sure that they have got positive coping skills in place before you start delving into all this stuff.
Now, what is a positive coping skill?
So if there is alcoholism or substance abuse, you want to treat those things first. So you might teach them when they get really anxious or stressed out to start an exercise program, or to start reaching out to their friends and family more, and maybe go to a support group or something like that. Something that's going to build them up rather than make their symptoms worse.
Mm-hmm. Of course, again, alcoholism is the old expression, drown your sorrows. So I guess that's what that is. So in other words, before you would begin treatment, you would want to get them to stop drinking and stop taking drugs?
Yes, because a lot of the, you know, I said the alcohol, sometimes it works to take the edge off and helps with the anxiety that they're feeling. But of course, some of the drugs that they are turning to, and this is getting to be a very recent thing, the drugs they are choosing to use are making their problems much, much worse. And I'm seeing a lot of synthetic drug use. I'm seeing a lot of soldiers using, you know, the K2, the Spice, the Red Dove, bath salts.
What are all those? I don't know what.
Some are like K2 and Spice are synthetic marijuanas. Red Dove is like a synthetic form of ecstasy.
A synthetic marijuana? How do you make that? Not to give anybody any ideas.
I don't know how you make it.
But I mean, what is it? Is it a plant?
I really don't know.
But it's synthetic marijuana.
It's synthetic, and the laws can't keep up with this stuff fast enough. So some of it isn't even necessarily illegal.
Wow.
But with like the bath salts seem to be the worst. They are causing, you know, permanent psychosis in some of these soldiers. And one thing that people don't know about PTSD, you can have hallucinations in severe PTSD.
You can?
Yes. I've had soldiers before that talk about maybe seeing someone that they killed, or seeing the family of someone that they killed in the back seat while they're driving down the road. So when you throw drugs into the mix, it makes all of that worse.
Wow. Well, now, is there drug therapy to help it?
There are medications that help it. You know, a lot of times you'll have nightmares, a lot of sleep problems with PTSD, which is again why alcohol can help them fall asleep. So sometimes sleeping medications, of course, you have to be very careful with creating more dependency. There is a drug now they're using that is supposed to decrease their nightmares. Not really sure how that would work. Antidepressants seem to work really well. And you know, anxiety drugs work well. Some of them are so severe that they have to be put on what's called mood stabilizing drugs. So sometimes the PTSD can even look like a bipolar disorder with the severe mood swings. So really, over the years, I've decided it really is the worst psychiatric diagnosis you can have. I think PTSD is worse than schizophrenia.
Wow. Well, is there a part of the brain, I mean, I know that mental disorders are different than physical. I mean, I can x-ray you and see your broken leg, but is there a certain part of the brain, I mean, what's the research on this? Do they know what the physical trigger of this is yet?
Well, it's the trauma itself.
Right. But is there some part of the brain that is affected?
Well, it's considered an anxiety disorder along with the other anxiety disorders. And it's actually learned through a process called classical conditioning.
Explain that, please.
Well, have you ever heard of Pavlov's dogs?
Yes, the salivating dog.
So Pavlov taught these dogs to salivate at the sound of a bell or the sound of the researcher coming down the hall. Naturally, they're going to salivate to food, but he conditioned them to salivate to these other things. So in PTSD, it's they're learning to react to these ambiguous stimuli as if they are scary and traumatic. So over here, sounds of a helicopter don't mean anything. That's ambiguous. But they've learned to associate that with danger. And so that's classical conditioning, and they will generalize that response to a lot of other situations, which might just be strangers, people they don't know come in the room, and maybe they have this anxiety response. So it will generalize to everything, to the point that some of them even become agoraphobic and they avoid even going out in public. A lot of them don't like to be around people, and part of that is the anxiety symptoms, but part of it's also that they feel that no one can understand them. No one, they can't talk to anyone about these things because they don't want to be judged. And just no one else can understand what they've been through.
I wonder too how much of this is connected to the nature of warfare today. It's in essence guerrilla warfare. There are civilians with the improvised explosive devices. It's not like a classic war where the enemy is wearing a uniform on the other side of the battlefield and you can easily recognize him. Do you think that's part of it?
I think it's a huge part of it. And that, like I said, now some of the symptoms involve being uncomfortable driving, and that's related to the warfare. Most of what I see are infantrymen. So they're doing hand-to-hand combat. So the closer you are to the enemy, usually the more traumatic it is, because you can put a face to it, and that makes it a lot harder. And that's why also certain branches of the military have higher rates of PTSD. So if you're flying a plane over and you're dropping bombs, you're not ever seeing them face to face like you are when you're doing hand-to-hand combat.
So this is much more prevalent among foot soldiers. That would make sense. Yeah. Well, turning to the civilian side, what are some of the, without mentioning patients' names obviously, but what are some of the cases involving civilians that you've dealt with PTSD?
A lot of sexual assault cases, sometimes children who were, terribly physically abused or emotionally abused or neglected. As children, they will grow up and still have symptoms of the PTSD, and a lot of them will be re-victimized. And that's something else I've seen with soldiers, that a lot of the ones that seem to be more prone to develop PTSD have a certain kind of background. A lot of them were, abused as kids. So for whatever reason, that makes them less resilient and more prone to developing these issues.
Well, now, where do you see your patients? In Hopkinsville?
Cumberland Hall.
At Cumberland Hall. So they drive up from Fort Campbell themselves, or are they brought up, or?
They're hospitalized there.
They're hospitalized?
It's an inpatient hospital.
Okay. Is that part of Western State Hospital?
No, it's not. It's a privately run hospital.
Okay. So typically, how many patients from Fort Campbell would you see in there, or are in there at a certain time?
Well, I'll tell you this. That hospital, it's brand new. About a year ago, they rebuilt it. They had to move it closer to Fort Campbell, and they now have a whole military wing in that hospital.
Well, do you work with military doctors?
No.
It's all civilian?
Right.
Well, the military does have psychiatrists and psychologists.
They do.
Is there any reason why that I would think this would be you would be exchanging patient notes with military medical people?
They probably see my records. I'm sure they do. I don't ever see theirs.
Well, now, are these soldiers still on active duty? Have they been discharged?
A lot of the ones that I see are maybe in the process of being discharged, medically discharged, some dishonorably discharged. Some that I see have been charged with crimes, so various situations.
Well, I know we talked earlier, it's difficult to put a number on this, but we were talking percentages before, the odds of you coming down with this. Tell us about that.
Well, with each deployment, the risk of developing PTSD is about 20%.
Of any soldier? Of
any soldier. That's for all of them across the board. So the reason we're seeing so much more of it now is partially because of these multiple deployments. So if you deploy 3, 4, 5 times, your risk is going to go way up. So we are going to be dealing with these problems for many years to come.
We talked earlier too about the difference in World War I or World War II. You know, you went to Europe and you fought in World War I, and you'd be several days or weeks coming home. And it was true in World War II as well. There was a point system where the longer you were in combat, the quicker you got to come home. But even so, it would be weeks before you came home. But these men and women, you're in Afghanistan and you get to leave and you get on a jet and you're home within hours,
Yeah.
with the dust of Afghanistan still on your combat boots. That's an effect too, is it not?
Yes, there is no debriefing that takes place. They really need that time with their fellow soldiers to kind of decompress and you know, prepare for coming home. And I've also heard a lot of them say they would rather be deployed than be at home. And sometimes that's how I know that they have PTSD. They want to go again. You know, and I know that's weird. Life here, sometimes it's easier to deal with the military stuff than it is to deal with problems at home. And life here, frankly, is quite boring when you compare it to what they've seen and done. So a lot of them will also, that's part of the reason for the drug use too, but they will also engage in thrill-seeking behaviors, really dangerous kinds of stuff. I know of one that would, they like to couch surf, where they would attach a couch to the back of the pickup truck and pull it down I-24 and try to stay on top of it. So they do a lot of things like this, yeah.
And that's why?
Because they're bored here. They had so much going on over there. It was exciting. You know, you're under attack, or even for some, I've talked to some who talked about having to kill someone. That, you know, by our nature, that's an exciting thing. Not to make it, this is really hard for people to understand.
I know what you're saying,
it's an adrenaline rush. And a lot of them are very disturbed by that feeling of getting that rush when they have to do something. They have to do it. And so they come back over here, and there's no comparison over here.
Well, I'm going to guess, not being a veteran, know anything about how the military operates, I would assume the military, the idea of getting a soldier home as quickly as possible, they think that's great. That every minute you stay away from your home and loved ones is traumatic, and that's why they get them over here as quickly as possible.
Right.
Would that be probably true?
Probably, yeah. And for the ones who are not as susceptible to PTSD and don't develop the symptoms, it is good for them and their families. Yeah, they want to be home.
Right. Well, now, of course, post-traumatic stress disorder. Post means obviously afterwards. How long is there a typical?
Okay, the first 30 days after you're exposed to a trauma, if you have the symptoms of feeling numb or detached, nightmares,
now,
not
numb,
being
you
able
mean
to
physically
sleep.
numb?
It's like emotionally numb, just not feeling sad or happy, not feeling anything. Re-experiencing the trauma, flashbacks, all of the PTSD symptoms. For the first 30 days after the trauma, that's called acute stress disorder. So a lot of people will develop that after a trauma, and it will abate, it will go away. If it stays beyond 30 days, that's when we would diagnose PTSD. Same symptoms.
So that's normal.
Yeah.
For 30 days after this.
Well, it's not normal.
Well, I mean, it's nothing that doesn't
if
mean
it goes away,
right.
It's fine.
Yeah. Does it usually go away in most people?
Well, I guess for each deployment, I guess 80% of the time it does for each deployment.
Yeah.
So.
Yeah. Wow. And where did you come up with those statistics? Is that the studies?
I went to a training a few years ago about PTSD and some of the newer treatments for PTSD.
Wow. Wow. And that would also be true if you witnessed a shooting or a car wreck or something.
Right.
That this is natural, I guess, if not normal. Wow. So how did you become a psychologist?
Oh, wow. Truthfully, when I was about 12 years old, I was watching it was like a Miss America kind of pageant, and the girl, one of the girls that won, was saying that when she grew up, she wanted to be a psychologist, and I thought, wow, that's cool. I want to be a psychologist too.
Didn't know what it meant though.
Nope.
Yeah.
So I knew that they figured out why people do what they do. Yeah, but even after, you know, I'm 10 years out of graduate school, I still can't figure people out. I'm more confused than ever.
But again, I think though, with psychology or psychiatry, it's so difficult because you're dealing with things that are really invisible.
Yeah.
As I said, if you break your leg, I can x-ray and say, you broke your leg, there it is.
Mm-hmm.
But with this, and then obviously, well, we have come light years from the treatment of mental disorders.
Right.
I mean, these early mental institutions were hideous. I mean, they were like torture chambers. And there's also has always been this stigma of mental illness.
Mm-hmm. And there still is.
There still is, yes. And that's got to also fuel this PTSD and cause the denial. They don't want to be considered crazy or whatever.
And the stigma is in the military, and the stigma is in society at large. I mean, just in the last few months, there's been more and more talk about we are not treating our mentally ill as efficiently and as effectively as we need to be, or we wouldn't continue to have like school shootings and things like that.
Mm-hmm. Mm-hmm. It's, yeah, but again, you go back to the hospital Bedlam in England, where it was just, well, how hideous. They even, you could even pay a penny and be admitted to watch they were called the Stars of Bethlehem. It was the Bethlehem Royal Hospital. I mean, to actually go to a mental institution and laugh at people is just, that says a lot about humanity that's not good.
Yeah.
But going back to the military, is it also because of this sort of macho culture in the military that you're supposed to be able to take this and not complain and go on?
Yeah. I don't know if, I hate to say this, I don't know if it's as much the macho culture of the military as it is the macho culture of men. Men in general are reluctant. They're reluctant to go to the doctor. So, I mean, they're definitely, they don't really want to go and talk about their feelings.
How do men want to go to the doctor?
They would rather deny that there's any, because if I don't go to the doctor, I'm not sick, right?
Right, right. Well, why do you think that's more the case of men than women?
I don't know. That's always been the case. I don't know. I have no research to support this. I just think they're stubborn.
I have read statistics that women are much more likely to have an annual physical than men are.
That's true.
That there are medical tests where men don't get them and women do.
Yeah.
And I've often wondered why is that?
Maybe women feel relieved when they go and nothing's wrong, and men just prefer
I always do.
to.
Yeah. I mean, yeah, absolutely. You love to get those tests back and go, made it again another year. Yeah, yeah, that's an interesting concept.
Yeah.
So if a student in the audience listening wanted to be a psychologist, what do you study to do that?
Oh, wow. Well, you know, getting a bachelor's degree is totally different than a master's degree. In graduate school, you study social psychology, you study cognitive bases of behavior, so how you think, how you learn, how you problem solve, memory. You study some about the drugs, medications, different treatments for different disorders, and you study all the different kinds of disorders, how to do family therapy, how to do testing, and most of what I do with soldiers is testing, personality testing, IQ testing.
So how do you test one's personality? I know an IQ test is, we did those in school.
Yeah.
But a personality test, I mean.
Well, the one that I generally use is called the MMPI. It's in the second version. It's 567 true-false questions.
567?
They're not real pleased when I hand them
I
that.
wouldn't be either. That's, how long does that take?
About an hour and a half. Depending on, if they are more psychotic, sometimes they're not even able to complete it because they can't think well enough to complete it.
Well now, okay, a test that long, obviously it's a valid test.
Yes.
You think it's
It's
valid?
one of the, it's been more researched than any other
great.
assessment.
Okay, but look, you're taking a multiple choice test, and you think, I'm just going to start marking anything.
Yeah,
for
it'll
true,
show
false.
up.
Oh, it'll show up. You can tell I just.
Right, because the same question will be asked about 4 different ways on there to make sure that each time they answer it consistently. It will also detect malingering, which I've seen some too in soldiers, because once they get the PTSD diagnosis, it can affect their income, their monthly income from here on out. So you do see some people that are trying to fake. You see that in the civilian population as well, though. They try to fake bad. Well, that will show up.
You can't fake it. You'll catch them.
Right.
Well, going back to just basic psychology, there are neuroses and psychoses. What's the difference?
When I think of neuroses, I think of Woody Allen.
Me too. Me too. Absolutely. You're exactly right. I totally agree. He's the classic neurotic.
Yeah.
And it's almost comical.
Yeah, I like neurotic people. Yeah.
But then psychoses, that's the bad stuff.
It's much different. They've lost touch with reality. Yeah.
What is the most common psychoses in the general population, would you say?
Well, a lot of people don't actually know that if you have severe depression, you can develop psychotic symptoms. Women with postpartum depression can develop psychotic symptoms. Bipolar disorder, you can have psychotic symptoms, and then schizophrenia and all the different delusional disorders. You could have psychotic symptoms with all of that.
Are there any general standard works on psychology you would recommend to the layperson just to kind of introduce himself or herself to the field?
Well, I actually really like probably the book that we use to diagnose people. It's called the Diagnostic and Statistical Manual. It's about to be released in its 5th edition. It's about this thick. They have them at Books A Million in the medical reference section. Every disorder, every psychiatric disorder is listed in that book with all of its symptoms, the differential diagnoses. So that's kind of interesting.
But I would say the problem with that is you'd start looking at that and think, I have this, I have
you
this,
absolutely will do that.
It's like
Yeah.
you know, I know people won't watch medical shows because they think, I've got that. So, you know, a little learning is a dangerous thing.
Sometimes, yeah.
But
it's better than WebMD, though.
Really?
Yeah, and it's better than the commercials for the drug companies, which list all these vague symptoms that we all have.
Of course.
Do you occasionally get a headache?
Yeah. And it'll scare you to death. And so it has to be an informed opinion.
Right.
Yeah. Well, is there like an idiot's guide to psychology? That might not be
there should be.
There really
I
should
don't
be.
know.
Maybe you could write that. That'd be a possibility. Yeah. Well, I enjoyed this. I'll have to come back and talk about other topics. It's as I said, psychology. When I took one psychology course in college, and the professor came in and said, "How many of you bought the textbook?" And we all had. He said, "How many of you turned to the section on abnormal psychology to see if you're crazy?" You know, everybody's fascinated with it.
Yeah.
In any event. Well, thank you for coming. My guest today was Leslie Page. I'm Barry Craig. Thank you for joining us, and we will see you next time.